Having a routine hip replacement operation can literally transform a person's life, taking away the constant pain of worn-out joints and giving a much greater freedom and mobility. But getting up and about as soon as possible after a hip operation is crucial to recovery. NHS Local has been to a hospital in Oswestry that's at the leading edge of patient recovery.
For patients coming for hip replacement surgery at the Robert Jones and Agnes Hunt Specialist Orthopaedic Hospital in Oswestry, Professor James Richardson and his team have implemented an innovative technique to improve recovery times.
Now, the stay in hospital when I came here was over 2 weeks. So one of the first steps was to change that tradition. And so patients would get up immediately unless there had been a problem identified in the operating theatre. This is what we're managing now, is to get patients almost universally up and walking on the day of surgery. So with all these changes coming in, we've dropped from that 2 weeks down to 3 days.
The reason for this change is the type of anaesthetic and pain relief used.
So a patient coming in for hip replacement can expect to have much better pain control than before. In fact, quite often now they say that the last pain they remember is the pain they had before their operation, and that's a big improvement.
Len Cater was the first patient to undergo the enhanced recovery procedure.
I had 9 months of continuous pain, in bed at night trying to go to sleep, all day long, every waking hour. And the time that I had my initial injection to go down for the operation, I've never had pain since. I'd envisaged being in for 5 days, and when they said they could probably come out the next day, I couldn't believe it. So I'll give it a go. And it was, for me, it was perfect. It's made a tremendous difference to my life. I've been able to get completely back to normal, which I didn't really envisage being able to do sort of 2 years ago as it was now. It was brilliant.
As part of the preoperative system, patients also have a chance to discuss the process with a volunteer who has been through the procedure.
I introduce myself by explaining that I am not medically qualified in any way, that I work through the League of Friends as a volunteer within the hospital, and that my role is to screen the patients to confirm their suitability for the rapid rehab program and the benefits to them of the program. Now, when you get out of bed the first time in hospital, the surgeon and or the physiotherapist will ask you to do that. And the idea of that is to get the blood moving in your legs again for you. And that's what's going to save you from DVT, deep vein thrombosis. They're able to ask me questions that they probably would not bother the medical professionals with. People have got all sorts of foibles and concerns relating to anaesthetics and hospitals and surgeries and being in somebody else's hands for a long period of time. And I'm able to talk those through them and quite honestly answer very candidly.
Within the team, the anaesthetist is a key player in the process.
Now, traditionally, anaesthetics have generally involved keeping patients asleep for the purpose of the surgery and providing some form of pain relief for the first 24 to 48 hours. And the usual technique in most hospitals is using intravenous morphine, which tends to make people feel sick afterwards, groggy, they feel sleepy. The last thing they want to do is to get out of bed. They don't want to eat, they don't want to drink, and the nurses are having to run around with a sick bowl in their hands, replenish their morphine syringes. So there's lots of work that morphine itself brings along. Whereas now we use a combination where the technique essentially involves giving a general anesthetics if you have to, but giving a very controlled and titrated general anesthetic using lots of antiemetics or anti-sickness medications along with painkillers well before the patient is woken up. And you combine that with the surgeon putting in local anesthetic, you don't need to use any morphine at all. For patients who are coming in for a hip replacement, your anaesthetist would visit you on the ward, and then he would, according to the protocol, the anesthetic would involve first an injection in the back called a spinal anesthetic, and while that's working, we would lie you on your side and drift you off to sleep, so you would become completely unconscious about a few minutes after having had the injection in the back. And then you wake up in recovery. You will feel that your legs are quite heavy, but one of them will be more heavy than the other, usually the one we were operated on. And within an hour of returning to the ward, both legs will come back to normal. And while the anesthetic is slowly wearing off, you will get a little bit of pain, usually mild to moderate. Most people would describe that pain as less than what you normally live at home with from the arthritic hip. And then You would have drink straight away in recovery. You'll have a cup of tea in recovery. When you get back to the ward, we'll try and feed you, providing you get there at the right time. You will get hot food that you should be in a position to keep down, eat and enjoy and keep down. And then by 5 o'clock, between 4 and 5 o'clock in the evening, a physiotherapist will come and get you out of bed.
For current patients, the hospital's approach has achieved fantastic results.
I had hip surgery 2 days ago. No pain. I'm up and around, doing good. I don't have any pain tablets. I feel like I didn't have hip replacement. This is the 9th surgery I've had, and thanks to Professor Richardson, I'm still walking. I could almost cry, I'm so happy.
How are you feeling?
Me, I'm feeling absolutely great.
Physiotherapists play a key role within the team to help patients get back on their feet as soon as possible.
On the day of the patient's operation, we visit the patient as soon as they're able to get out of bed. The process is checking the status of the patient, making sure that the spinal anaesthetic is worn off and they can feel and move the leg normally, making sure with the nursing staff that their observations are fine and that they are fit to begin their physiotherapy. For a hip replacement, we view functional mobility as being very important. We don't teach any specific exercises at this point. We encourage the patient to move normally in the bed, independent from sit to standing, and then teach them the safest way to use crutches and walk 30 metres. It's very important to encourage patients to move as soon as possible. It prevents post-operative complications like deep vein thrombosis. I feel it also empowers the patient to be independent and to recover from their operation as quickly as possible.
For patients, the key improvements are a reduced length of stay in hospital, better quality of care from all the team involved, and overall encouragement to get back on their feet sooner.
The patient feels more in charge of themselves, their time, their rehabilitation, and this gives them confidence. And just that confidence reduces their pain.
We are now getting requests back from staff members who want their own family members to be treated this way. So for me, there is no validation of the program than someone who works in the hospital who's seen the program wanting to be done exactly that way.
Don't worry about it. Just go and have it done and get rid of the pain.